My name is Glen Komatsu. I am a physician. I'm the Chief Medical Officer of Providence TrinityCare Hospice in Los Angeles, California.
Hi, my name is Rayna Oliver, and I'm a Health Equity Program Coordinator for Home and Community Care. I think it would be great if we got started with you talking a little bit about your background in healthcare.
So I started out as a pediatrician, then did a neonatology fellowship. So I was a practicing neonatologist. I took care of premature babies and sick infants, sick newborns. It was in that work that I really came to value the importance of listening to parents in their concerns about their babies. But it wasn't until I went into palliative care and hospice work that I really understood the value of listening to create a deeper connection with patients and families. Deeper listening involves trying to understand what the patient's trying to communicate. The words, of course, are important, but also noticing the person's body language, the emotions behind the words.
Have you noticed that patients respond differently when you are actively listening to them?
The sense of trust is really palpable.
Has the listening ever challenged you personally or made you rethink treatment now that you've better understood them?
It sometimes changes a treatment plan 180 degrees. A big example is pain. How people view pain is very different, and how people view pain medicines is very different. I need to ask them those questions, not just on a scale of 0 to 10, how bad is your pain? That's pretty basic. Asking them, how does the pain affect you? And people say, oh, it's not so bad. Or people say, I can't live my life. I can't do the things that I want to do. And then I ask them further about pain. How do you feel about pain medicine? Oh, I don't want to take anything like morphine because that's way too strong and I don't want to become addicted. I've had patients when I was younger say, thank you very much. And they put the prescription in a file cabinet and they never fill it. Every single patient needs a culturally specific plan because every single person of whatever color, whatever background, it's up to us to really figure out what that culture is. And it's also important to help the patient and family understand the culture of healthcare. That's where a lot of misunderstanding occurs, is because patients want a certain thing, but I have to explain to them that our system, your insurance, won't pay for that. Even though it's something that makes total sense, like a piece of equipment or a certain kind of medication, I said, I'm sorry, the system doesn't allow us to give you that. It's really hard working in a broken system, but it's a system that we have to live with and work with.
How do you push for providing your patients with the best care possible working with a broken system?
One example is that we really think everybody should have an advance directive and state somebody to speak for them, state their wishes about what they would want done if they can't speak for themselves. But that model doesn't work for many minorities. They're very mistrustful of the system. They don't want to sign documents. They feel like if we talk about death and dying or the end of life, that it will make it happen sooner. You have to be respectful of that point of view and say, we don't have to talk about that, but let's talk about what is on your mind. What are you worried about? Sometimes going in that way, people will say, I'm worried about my family. Who's going to provide for my family? I'm worried about being a burden. So you have to give the patient different ways to talk about their situation, their worries, their fears.
Trauma-informed care is something that is gaining a lot of popularity. I think a lot of people try to avoid those conversations because they're uncomfortable.
It's really helpful for me to hear those stories because then I know where the kind of the landmines for this patient are, what things trigger that patient and family, what things to really avoid, what things to really pay attention to. And so I can come up with a better plan for going forward, knowing what trauma they've already experienced. If we pay attention to that, people not only feel heard, but we can develop more collaborative plans of care with the patient and the family together, which is the way I think medicine should be practiced, is that we do it together as partners as opposed to, I'm the doctor, you're the patient, you do what I say.
It shows in the statistics that patients that contribute to their treatment plan adhere to it.
Listening to patients and families has helped me become a lot more creative about the way I think about healthcare. When they have a say in their care, they're much more likely to follow your instructions. They are much more likely to feel included and invested in their care. Working together, we can really help you have the best quality of life that you can have.